Oh my God, I need to borrow $1 million.
What's going to happen to you in 30 years? You just want to survive at this moment.
Banks and financial institutions love when physicians buy the real estate.
The lenders love physicians.
The tax code provides a great ways how to save on taxes.
Your husband is extremely creative.
And when there is no opportunity to buy, what do? You build it.
Yeah.
But still, you should not build a 11,000 square foot building with ChatGPT.
Our motto is to provide the best care, the best quality, and provide the best experience for little children.
And now you can either stay a landlord and collect all this passive income and have the ability to travel and live life.
When you sell the business and you have the new owners that buy your practice, and they have another 10 years on the lease, then you sell an investment product. It's not even a building anymore.
Wow, that's a lot to know. It's a lot of information, guys.
Welcome to the Ask the Dentist podcast with Dr. Olga Dogear, where your smile meets your overall health.
I'm very excited to have a new guest at my podcast, Ask the Dentist. We have Bobby Mastrachi here. She's a business owner, and we're going to talk about all sides of business, commercial real estate, how it's all interconnected, and why it's so important for future dentists, medical professional and so on to understand the business side, because we get a great education in dental school, medical school, but we never thought about that my profession in general has small business side of it. And also in my studio today, we have Adrian, who happened to be my husband. And he's the person behind who always trying to have new ideas. He helped me initially to start up our small business, and he is all about business approach, real estate. So that's why I have everybody together, because I do clinical side and this is business people. So we're going to have a lot of interesting information. So Bobby, can you tell us, how did you end up in general in commercial real estate?
Wow. Commercial real estate. It's something I've always wanted to do. Kind of like Adrian on the creative side, wanting to see dirt become something. So, and it just all evolved into working with the real estate part of site selection and business development.
Very interesting. Adrian, how did you, when we started, I remember our first practice when we opened, I was overwhelmed with all the ideas, all the possibilities. And I remember you took over and kind of guided us as a family to one direction. Can you tell us, how did you end up meeting Bobby and how we bought our first property?
Well, originally I was looking for a representative in commercial real estate. I didn't know nobody in the field, and I started asking around for the people that were somehow connected to it, and I was referred to Bobby. And so I called her. I remember we were in Pennsylvania. We were during your residence in Pennsylvania. I called. Bobby picks up the call, and she said, "Can you give me 30 seconds?" And I was like, "Oh, maybe she's got another call on the second line." And I'm like, "Yeah, sure, by all means." And she's like, "I just want to pull over so I can make sure that I have a quality conversation with you." And I thought to myself at that time, I don't know if you remember that. And I was like, okay, well, that's a good approach. It's like, okay, you have all my attention. That was the message. Okay, that's great. Pulls over, wherever in Arizona. We're in Pennsylvania at that time. And so it's like, "Bobby, this is what we're trying to do. This is what we're planning to do, blah, blah, blah." And that's how I connected with Bobby the first time. Then I flew to Arizona a couple of months later because I like personal approach. I like to talk people. I want to have eye-to-eye contact. And we flew because we wanted to see some additional information, on how you approach real estate. Why do you need to do this? What are the locations? I mean, there's so many aspects. It was so new to us that we decided. I remember I flew for just a few days. I met with Bobby in her office, And that's kind of how we established the connection. And it's been over 12 years now, and we worked together for all this time.
So I remember when we were making this big decision between buying and renting. I think it was like one of the burning questions. I felt like probably buying is a good idea, but I was afraid for, like you said, rejection, because there is a possibility that it's just such a big amount of money you have to borrow. So, Agent, remind me, how did we come up with this idea, buying versus renting?
The idea came up actually from asking the question from a different angle. As a matter of fact, when the bank said, I need you guys to do a business plan, and we did the plan, and I was working on the plan. And at that time, when I was working on the business plan, I realized at one point that I'm actually doing real estate planning. I'm doing estate planning. That I started asking more and more questions. You always ask your whys. Why is this? Why is that? So when I was working on the question, one of the things that I was getting really curious about it's not how we're going to start the business. It's not because at that point, everything was more or less clear. We need to approach the banks. We need to approach this, agents, consultants, all the stuff we need to say. But the next question that I had in mind is, what is going to be my biggest problem in 3 to 5 year period? And in many cases, people are still focusing on the startup of the enterprise. They don't think, well, in 5 years, who knows? Right now, we're focusing on opening.
Everybody's focusing just right now. Yeah,
just
for
right
sure.
now. So I asked myself a question, what is going to be my problem in 3 to 5 years? So at that time, I started asking, and nobody really shares. And these days, probably there is more information out there. But back at that time, 10 years ago, there is not a lot of information. So by analyzing from a different angle, asking the search engines, different type of question, derivatively, I've came to the conclusion that the biggest problem that businesses encounter 3 to 5 years, they run out of space. Because they, first of all, problem number one, they get it small because they don't want to have big expenses. So get it small to begin with. But then they don't realize that if you're doing the right way, you provide great service for your customer, for your patient, then business is going to grow. And then you ended up 3 to 5 years getting really tight. You cannot expand because, first of all, you don't have control over the real estate, and there is the owner of the real estate is already leased out to somebody else 5 or 10 years. And what do? Do you relocate? Well, you have a 10-year lease. You cannot relocate. You have to pay off the lease for the rest of the time if you want to relocate, and that's an expensive proposition. Now you need to borrow more money to develop into a new area. It might not be available. So there's all these issues that are showing up 3 to 5 years from now. So the idea came in as like, well, how do I mitigate this risk which right now it's not showing up in the books, but it will be there if we successfully open the enterprise and manage it. So that's how the idea came out. There's like, okay, we need to buy real estate. We need to buy bigger size real estate. We'll take a portion for us. We'll have a short-term leases for the rest of the building, and that's what we do. They do like 2-3 year leases.
Yeah.
And then when you're ready to expand, you just tell your tenants, we're not going to be able to extend the lease because the enterprise is expanding, and we're going to take it for us, and we are going to expand into the new space.
That's right.
And that's how the whole idea came around to buy the real estate, is actually to have control over the future expansion that you might have, you might not have, but we were confident we're going to be able to grow.
You were absolutely right, because I remember when 6 years later, we started to introduce orthodontics braces, and we actually, in our original location, we absolutely did not have space for additional provider to provide this care. So we actually were fortunate, and because we owned the rest of the building, we just expanded into adjacent space, and we were able to create sufficient space for second provider for orthodontists at that time. So it's actually worked out. So I think long-term planning, I think it's critical. And for the new graduate, you have to think about, I think the rental, like you said, it expires a certain time, and the uncertainty what's going to happen with the space is huge. First of all, you can, like you said, actually grow out of that space you own. Secondly, you don't know the plans of owner who owns the building. Maybe at that point they decided to sell to somebody else. And I think a lot of providers run into that issue, right? All of a sudden your rental goes up, right? Or they probably have completely different plans and they not allowed you to sell. So you technically just invested a lot of money to do TIs, right? And you expanding, you have your group of patients, all of a sudden everything gets canceled and you have to move to a completely different building and you kind of starting over from zero again. So that makes a lot of sense.
And then if you do the lease, say you're going to lease, then you bake in options to extend. But a lot of landlords won't offer you the extensions or options, especially if they're the one that is going to want to take the space. So as a tenant, if you're going to lease and you have that, you want to bake in a couple different things, right? One would be first right of refusal to any adjacent space to expand into. And if you're like your lender is going to require you to do a 5 or 10-year lease for an SBA loan for your TI because it's going to take that long to pay off your loan. So they want security that they're going to get paid back and not have you leave. Options are a lot of times at the then current market rate, but never less than 3% from the last year of the term, so that as the owner or landlord, that you're guaranteed that income that you're used to getting or higher. So it's all what side of the table you're on and how to protect yourself. And then as independent providers, as a tenant, a lot of the times you have to, and it's hard to get this clause in the lease, but it's a death or disability. Right.
Oh,
so
that's right.
if you're the only provider bringing in the income, and I want to go further on that, and you are something happens, God forbid, that you have a stroke or you're disabled or you die, that lease is your family's responsibility. And if there's no income coming in, who's going to pay for that lease? So that's another thing that we add there. And then going into like the first conversation we have when we do our discovery meeting with clients is we ask them like, we talk a lot about how you got to where you are today, but we also talk about your exit strategy, your 5-year, 10-year, 20-year plan, so that we can, one, get you into the proper lease term and protect you and your family, but also where we're going with it.
Because they don't teach us at dental school or residency, like, do I rent the building? That was my first question. Do we rent the building or do we buy the building? And I remember briefly somebody was mentioning at school that long-term buying the building was better investment than renting.
Right.
Yeah. Yes. So that's how we end up kind of start looking.
Right.
Yeah. And when you out of school, for all the new graduates, you overwhelmed with information, you own debt from school. So to gather all this information together and come up with a plan, it's a challenge.
It is. It is. I remember I used to go to an eye school there, the optometry school on Thunderbird, and I would host classes there for the students, and it was just one class for every year, and we would talk about the leasing process and what you need to do to lease, and then the difference between leasing and buying and how to prepare for the loan, and it helped them because that was the only thing that they have heard of for the real estate part of it. So
Yeah.
it's all about the medical, right?
Yes.
And nothing about leasing or business.
Yes.
Yeah.
What is your perspective? Why do you think like long term for new professional who just graduated medical dental school, why is it better to buy a building, or do you think let's go back, orienting is a better option?
Right. Well, of course you have a lot of student loans, right? And I'm sure that you'd be able to answer this question better, but many people work for another physician,
Yeah.
right, practice. And then after they get through that process, then they'll go out on their own. And then we talk about exit strategy as well. Like, where do you see yourself? And we'll talk later about that. But the lenders love physicians. Anything medical related, you can get 110% financing. So it's not cash out of pocket. So the financing is something like, if you, once you're done leasing, you hand back the keys and you have nothing to show for it. But when you're done with your practice or done with the building, like, if I can share your legacy and what,
Of course, yeah.
what our exit strategy is by owning, you have the ability to, like, how many practices do you have now? 7, 8?
Six.
Six. One out of state, and
That's 7. Well, now it's
Gonna be out of
Right.
state, yeah.
right, so 7. And the exit strategy is you're building and expanding. I want to talk to you more on that too, on what you're doing in your business to be able to trust and grow and train other dentists, right?
Yeah.
But your exit, let's just say, I don't know how many years, 10, 15, 20 years, 30 years. When you exit, you have your practice to sell,
Of course,
right?
yeah.
And now you have all your buildings with other tenants in it,
Yeah.
with passive income.
you generate passive income. That's
Right.
right.
Yeah.
And now you can either stay a landlord and collect all this passive income and have property managers manage all that for you. So you have the ability to travel and live life. And then if you decide you want to sell that portfolio of income property, you're going to be able to sell it for more than if it was a vacant building,
Of
right?
course.
Because it's
Of
going to
course.
be based off the income.
Yeah.
So you have the practice to sell, which is income. You have being a landlord and just holding the real estate, which is passive income. Or you can, gives you very many options of how you want to exit.
So long term for you new graduates, long term, if you, I know when you just graduate, you don't have that perspective of life, what's going to happen to you in 30 years. You just want to survive at this moment. You want to get all the experience. You want to get the best practice, do everything. You're not thinking about you as much older person and when is your exit. But if you look back, I think that was the right strategy, right?
Correct. And I think it's important to differentiate, selling a building and selling the business and then selling the business, the building, because there is a distinctive difference between the two. What Bobby was referring, he was selling the business at the cap rate, because when you sell the business and you have the new owners that buy your practice and they have another 10 years on the lease, then you sell an investment product. It's not even a building anymore because it's a income producing property. So those are sold usually 30 to 40% higher than a vacant building. You will sell it on the market because it's an income producing property and it's an investment asset. So that's a big difference between a building, a standalone building, and a building with a 10-year lease on it.
So rent, then it makes no sense for young graduate, or does
it makes no sense. The new graduates are afraid of buying because they are afraid of rejection. Because they're like, oh my God, I need to borrow $1 million to do a build out, to buy the equipment, to do all the things. well, then I need another $1.5 million to buy the building. And they're like, the banks are going to refuse because, and very often it's based on assumption, the banks will refuse to lend me so much money because I'm already borrowing a lot of money. But in fact, banks actually love when physicians buy the real estate
Bobby was
because
saying,
it's a collateral. And as a collateral, it's a risk management for the banks. They have a piece of property that has certain valuation. So if anything, it does change your balance sheet though, because now you have more debt on your balance sheet, and that could impact your future expansion. That's probably the only negative from this. But other than that, banks and financial institutions love when physicians buy the real estate.
Interesting. What other small businesses or what professions banks like?
Definitely medical. You got
Definitely medical.
top, yeah.
Uh-huh.
I can tell you what they don't like would be restaurants, bars, anything like that. But one thing I wanted to add to your comment, Adrian, is if you're borrowing money for tenant improvement, TI, you called it, you're putting the TI if you're leasing into somebody else's building, right? So the landlord's not going to pay for your custom building to run your business. They'll offer you TI allowance, tenant improvement allowance, like to offset the expense. However, they're not going to pay for it all. So you're still going to have to get a loan for the build out and your equipment. So why not put it into your own building, right? The West Valley's a very tight market, so it's hard to find an office condo or something to be able to do it. But there's always opportunity, as we find, right?
That's right. Yeah.
And when there is no opportunity to buy, what do? You build it.
Right.
Yeah.
That's what we did.
That's right. Yeah. When we built our third location, Bobby helped us we knew where we want to open the practice, but there was no building.
Right.
That was a whole new adventure. And we never built anything before.
That's right. And at that time, I remember I was having a conversation with you and said, there's no, because we wanted to go in Verado from day one. Yes. They would refuse us every time. And because they're like, well, you don't have a business record. You don't have a track record to prove that you can successfully do this whole ground up, build up, and TI as well. So, of course, the banks are very skeptical. The developer is skeptical you are going to be able to get the loan, because one thing is to buy a building that was built 10 years ago. And another thing is to do a ground up. There is a certain inherent risk. That's why banks even charge more money during the construction phase of the project to justify the risk.
Right. That's right.
The construction's loan are more expensive than the regular loan. Once the building is up and everything is good, then when you close in and lock your loans, it's going to be significantly lower. But during the construction process, it's high interest to moderate the risks.
Wow, interesting. So for some of you who knows the spot where they want to open their new practice, if there is a land available, so there is a way to actually purchase a land and then start building up from the ground up, which is more risky, right? To start, right? More loan requirement.
It's more risky, but because if you have an existing building and you already need to do an improvement on the building, the risk is, okay, one wall might not go where it's supposed to go. It's an easy fix.
Oh, yes.
If you do a foundation and it's not stable enough, and now you start getting cracks in the building, now this is a big problem. And one of the reasons, because we did the two purchases of the building with the TI in the beginning, and what we ended up doing in the third project, the more I was looking into the architectural drawings, the more I understood that I'm not able to handle the project. It's just so much knowledge that it was required, and I don't have them, and I'm not going to go for this project back to school to study construction in details. So at that time, what I realized, and we always did it this way, you know what you don't know. And it's kind of like an oxymoron. What do you know what you don't know? Because But what ended up to be at that time, when I figure out that I don't know this and there's no way I can successfully manage the project, I called Bobby and I said, Bobby, I have a dilemma. And she's like, well, what is the problem? It's like, I cannot handle this project. It's too big for me. I don't have enough knowledge. I don't have enough skills. And I'm not going to be able to learn. And ChatGPT is not an option. Well, it's not even, it was open at that time. But even if it is not, well, but still, you should not build a 11,000 square foot building with ChatGPT, because it's just not an option.
Dirt up, right?
Yeah. Right. And I called Bobby and I said, Bobby, I need you to find somebody that it will manage the project, that will have the skill set to successfully bring from A to Z. I was like, I have a guy for you, actually. I met just somebody. He's opening his consulting business in construction, and I'll send you his contact information. You guys meet and have a talk. And that was Ron Barrett.
Yeah.
And I met with Ron, and Ron's like, yeah, I'll manage the project for you. And that was a great decision because Ron had the skill set and he was efficient. He was very knowledgeable. And we knocked that off in 7.5 months. We opened the business.
So technically, for people who are trying to build their own building, it's a good idea to have construction manager. A team, yes. You need a team.
This is our team and many more on top of it.
Right? Many more on top of it.
I call it my A team. Right. So you need the A agent, right? You need your accountant, you need the attorney, right? And then the rest of us that fit into the pieces.
Yeah.
But just from the dirt up, right? It's just not building TI. You had to figure out where the water retention went, right? You guys did that underground parking lot water retention.
We did a big water retention.
Which made it possible to build a bigger building and have the parking for it. So it was great. Yeah.
It was a lovely little project. I enjoyed it so much. And that's how we did it.
Interesting. So in commercial real estate, going back, what other like medical, dental, what other interesting? I'm just curious about the specialties.
Well, any office type, attorneys, title, if we call fire, finance, insurance, R, real estate, and I forget, executive or just any of those professions. And then look at all the retail development we have.
Yes, that's amazing on the west side. Yeah.
So any like Starbucks or Dutch Bros or standalone buildings, those are like little pad sites. And from just thinking of the net operating income, right? The investment property we were talking about, you have, say, Dutch Brothers, 900 square feet on a acre for all the cars that they have to stack, right? If you sold that building 1,000 square feet, or it'd be worth more just for the land than the building itself without the income. So those can sell for $800-900 a square foot if you're just looking at the building based on the cap rate. The cap rates are around a 5 here in Arizona, Phoenix market. If you sold it, so let's say that's worth $3 or $4 million, where if it was just to buy the property without the tenant, you're looking at $1.5 million. It's a big difference, right?
It's a big difference, yeah. Can you guys explain for our audience, because we have a lot of young professionals, what is cap rate? Because we keep saying cap rate. Some people don't know. Yeah. Can we explain what it is?
Why don't you go?
Cap rate.
Cap rate, yeah.
Cap rate is, it's just a picture of the first year income. So it's a quick way to analyze the market. Until you go to purchase it, then you have to do a dive deep and look at what your internal rate of return you want, and to analyze the length of the lease and the increases. And so there's more to it after that. So a cap rate's just a quick look. So the lower the cap rate, the higher the price. The higher the cap rate, the lower the price. So it's your return on your investment on a picture of year one. Right. Does that make
Because
sense?
cap rate, it really means it's the return on your investment.
Uh-huh.
And what it does, that's why Bobby correctly stated, it's a inverse correlation. The lower the cap rate, the higher resale value is, because that means that the return on your investment is lower. But the reason it's lower investment, because it's a more assured return. When you have a Starbucks or Dutch Brothers or any of these big corporates that you have a corporate guarantee, of course, investors love that, and they are willing to pay premium pricing for that property, because they almost have zero, not almost, it's pretty much zero failure rate, because you know that you will have that return for the next 10, 15, 20 years, or whatever the lease agreement is on. So that's why the lower the cap rate, the higher resale value is, because it's a premium pricing.
Premium price. From my understanding, for our listeners, to find a good location, visibility is the one, right?
Yeah.
But I remember when we were looking for a good building, we couldn't buy a land where Starbucks is right now, because it was already not bought by Starbucks, but how does that work? Because I remember I was like, I want to be where Starbucks is, and I could not get that land.
Well, you're
Remember?
right next to Starbucks.
I'm next to Starbucks, but I'm not at that one corner. For me, not being in the business, I was like, I don't know, it's so unfair. So how does that work?
You could, but Adrian's too cheap. He's all about the number, the bottom line.
No, as
So
a matter
why
of fact,
would
if you remember, that's not quite the story. But if you remember, the developer wanted to bring retail in that corner, and they wanted to bring Starbucks, and I said to Bobby, it's like, Bobby, I want to start negotiation on that. And she's like, well, Adrian, are you going to go against Starbucks? I said, I'll go against anyone. It's an open market.
Challenge me.
Yeah, it's like, don't challenge me. I'll go with this. I might not win, but I'll put a good fight on it. And they were like, they would even refuse to consider that, because they wanted retail on that corner.
So the way it works, the land belongs to somebody, right?
The seller, yeah.
The seller, and seller already kind of have in mind what he wants where, right?
Yeah.
That's how it works.
Typically, like if it's, if we'll use your Verado location as an example, the developer, DMB, already had a site plan and knew what they wanted where, like the hotel right behind you,
Yes.
the retail along the main artery. But to your benefit, those are people attractors, right? So
Yes, for
and
sure.
they have to come in to enter that parking lot and drive right next to your sign. So
they need to stand in a drive-through line and like facing our building, which is nice.
Right.
Yeah.
So they pay double for their square footage and their lot that they pay for, right? We got a really good deal on ours.
We got the smoking deal there.
Yeah.
So
Before
that's
the
because
price.
he pushes me. He's like, get it, I want this price. I'm like, okay. But no, we're pretty good negotiators. And then just that your name and your reputation makes it easier for me to do my job too. So thank you for that.
Thank you.
But you can benefit from, they call it anchors, right? So we have them as an anchor, and it's all about accessibility. And then when we do site selections, we really dive deep into the demographics, which is extremely important, not only to be able to read the demographics, but to understand what the demographics mean.
Yeah, that's another good question for new starters, demographics. So how do you guys justify the need, for example, for newcomer, for dentist, or for example, for pediatrician, or for any other profession? OBGYN. Like how do you look at demographic? At what factors are you looking at?
Or look at the opposite, right? You have the older people, like what services are they getting?
Of course,
right?
yes.
So Adrian is the one that dives into, we supply Adrian with the demographics, and he's the analysis of it. And we can do gap reports to show you where the demand is and the lack of service.
Okay.
Right? And then Adrian has a formula.
The demographic analysis, Bobby provides me the data. I break down the data the way I want it. And in this particular case, because we are focusing primarily on children, I'm looking at the number of children living within 1, 3 to 5 mile radius, and also looking at the average age, because eventually if the area gets a little bit older, there's going to be less children there. But the important part is to understand that where we look is at the ratio of children per provider. Because one of the misconception of the younger professionals and very confident men and women out there, they're like, I'll go into this area, I'm so amazingly great, I'm gonna do all this, everyone is gonna start coming to me. Well, the reality of the situation is patients are happy where they are, and very few are gonna come to you. As a matter of fact, the ones that are gonna come, they are unhappy where they are, and most likely they will be unhappy where you are. So some people just can't make them happy, regardless of what you do. So what we don't rely that our competition are gonna lose patients. As a matter of fact, I don't want them to lose patients. I want them to be happy and work and continue to thrive and to do well in the business. What I'm looking into the area, that is there enough for our competition to do well and continue to succeed and flourish and grow their business, and there is enough growth in the area, because the growth, that's where the patients are going to come in. We're going to still have to split with our competition, which is okay, but because the area is a high growth area, that means that those newcomers into the area, those young families with small children, I have 50% chance of getting some of those patients into my office. So our competition is going to get, we're going to get, everyone is going to grow, everyone is going to be happy. So don't rely on the fact that I'm so great and so amazing, a competition is going to lose half of their patients. It's just not going to happen. Not even 1% is going to leave their practice when you come in, because they are comfortable where they are. And as a matter of fact, every physician, every doctor, they try to provide the best care, the best service for their patients. So 99.9% of those patients are happy where they are. So nobody's going to leave. So you're looking into the area where there is growth, there is new developments, there is new people moving into the area. So you have a certain percentage for the newcomers. If you're searchable on internet, on Google in particular, then you have a chance for them to choose you, and some will choose your competition. So everyone is going to do well in that condition.
Not that you have to give away your formula, because I don't want you to share your secret sauce, but you do have it down to how many of each age and that you need to run your office off of, right?
That's exactly right.
And that's the secret sauce, is having that knowledge.
Having that knowledge, who is demographic population and projections probably, right? Yes.
How projection very often is going to be based on the average age of the adults in the area, because those are the families that either have small children or are going to have additional children growing their families. So to me, it's one of the criteria that I'm looking at. It's actually what is my average population to the area. So the younger the population, that means there's more babies are going to be born in that area. So it's going to be greater for
that, and where the elementary schools are planned to be built.
Yes, that's a big one. Yeah,
they're looking at the same data as I am, because more babies are going to be coming to the area, more schools are going to be needed, and subsequently
we've also looked at other practices, right, that have gone on the market. And once Adrian dove into the demographics, he's like, no wonder they're not making it, because of there's not the growth, there's not the age group that you're needing for that particular pediatric dentistry. Right?
So knowing the population, so do you work closely with the city, for example, city of where we are on the west side? So do you have the knowledge of the future?
Yes.
Do you know how where city is going to grow?
The master plan.
The master plan, that's probably very important, right?
Right. And relationship, like we're very close with the cities, and we know the economic development directors and the planning. And of course, it's you eat it and drink it and live it 24/7. So if like you're in dentistry, right? You're engulfed with it.
Yeah.
And that's kind of how we are with real estate. It just you're aware, you study it, you watch the trends, you're aware of where the freeways are coming in, when they're being built, like ADOT and MAG, you watch the websites, and then we have the tax bills and where that money's going. And then we meet with them, the West Valley Commercial Real Estate Group. We meet the third Friday of every month, and we have speakers come in, and once a year we'll have MAG and ADOT come in, and they talk about the growth and what the timing is on it.
Oh, that's
So
so
like the
interesting.
101
Yeah.
and 10, how that used to back up.
Yes,
and they
yes, yes,
added
yes.
The extra lane.
Yes.
We knew about that before it even happened because of having them as a speaker.
Wow, wonderful. What about now? Are they expanding that I-10 further down? Because is it getting like a bottleneck next to Virado right now? I was thinking, yeah.
Yeah, that's all expanding. You guys just had a beautiful expansion done.
Yeah.
But now they need to widen your exit.
I think so.
ramps,
Yeah,
right?
because there is so many commercial buildings are going up
You
there.
just have to be back road Bobby.
Yeah.
Just take all the back roads around it. Yeah.
That's right. That's
And
right.
there is a little trick, like going to Verado from heading west. If you hang out in the north side lane, the to the right, as far as you can go. So usually I hang out in the HOV lane and then cut over. But right as soon as you're at the 303, you definitely want to hang because of all the exits, and then you can go as far as you can before the lanes merge over. So if you're ever stuck, go to the right.
To the right. Okay, I'll keep that in mind because it sounds like it's going to be more and more congested in the future with all the construction going.
It's always red right there.
Yeah, that's right. It's always that. But I remember when we moved to Phoenix metro area, same thing was happening between 101 and I-10.
Yeah.
And finally, when they expanded, it's like, whew, the relief.
It helped.
Yeah, hopefully they expand further down there.
Now we need traffic signals on like Jackrabbit and McDowell and just like for all the back road people.
That's right.
It's just bumper to bumper back there too.
Yeah, the valley is growing and expanding. Yeah.
Another thing we could talk about with development, when you're driving down the road and you have 3 or 4 lanes and it goes down to 1 lane and then 3 or 4 lanes and 1 lane, that's because the developer's responsible for putting in the road in front of their property.
Oh,
right. So if you're going out to buy land, you have to know, like, have a consultant, Ron Barrett, Braden Management, and find out exactly what you're responsible for. So if you're at an intersection that needs a traffic signal, who's putting that in? The developer.
The developer.
They're paying for it, not the city.
Not the city.
And it's not cheap to put those light signals in.
Right.
Yeah.
The acceleration lanes, to turn in.
That's all developer. Oh, wow.
So you're decreasing the size of your property, and plus you have to finance the stoplight. And one stoplight, if I'm not mistaken, it's about $250,000 on one intersection.
Oh, wow.
So they are very, very expensive prepositions. So those corner lots, they're great, but you have to look into what are the extra expenses you're going to need.
That's a good point for our listeners. So if you decided to pick a land and buy it, you have to look at deceleration line, right?
Acceleration,
deceleration.
Because it goes in two
Wow.
directions.
That's so many little details.
I remember we were looking at property on Bullard and Van Buren, and it was a hard corner, and the traffic signal was there, but the land was cheap. I'm like, why is it so low? And they're because you're going to have to pay another $5 a square foot to pay for the traffic signal that once you start development. And we're like, oh,
that's why. Wow.
Thank you for sharing. They didn't even wait till we got into due diligence. They just disclosed it.
Disclosed it right away because
waste time.
Yeah. Interesting.
But I wanted to talk to you. Like, I'm so impressed with how many locations you have.
Thank you.
And as and well-deserved, as a small business owner myself, the being able to grow the business and have other dentists in your practice, you're training them your way. So you're giving away your secret sauce, right?
I don't think there's a secret sauce.
Okay. So how are you doing that? Like bringing other providers in, expand, like you have 7 locations, you're one person, you can't be at all of them. How is that working? How are you first hiring and expanding, and how do you know when?
So our practice is very specific because we are pediatric, and I hire only, there is a certain criteria my provider have to meet. They have to be residency trained and board certified, or on the way to become board certified. Board certification is like a last level of education. So you can be residency trained, and then you have to take that exam to be board certified. And then we technically, that's one of the criteria. We only hire pediatric dentists who have this training. And then we have overall like structures already in place. And residency training helps because most of the doctors in the country, they go through certain type of level of training. So these people, because you spend additional 2 years after dental school or 3 years after dental school doing just your specialty, they already have a good knowledge and understanding what expectations are. And then you tailor that to your practice.
And where did they do their residency at?
It depends. There is a lot of residences in the country.
Okay.
There is a hospital train, there is a university train. So
Okay.
they receive that training. And then when we hire them, they have to kind of blend into the model, what we have. And our motto is to provide the best care, the best quality, and provide the best experience for little children. So,
Well, but Bobby's question really was, how do you have all these doctors that were trained in different places? They obviously, there is a certain guidelines where everyone has to meet certain criteria to graduate. Nonetheless, the approach could be slightly different from school to school. How do you make it where in this practice is universally, because you don't want the patient to come in and you're offering a certain treatment approach, and then they see another doctor the week after, and suddenly they're like, no, this is the wrong approach, we're going to do it this way. That could create a lot of chaos and turmoil in the practice when you have two different opinions. How do you train, and how do you make it more or less universal throughout different doctors, different trainings that ended up to have the same approach to the
we always communicate. Initially, when I hire them, I show them exactly what we do, and we practice by guidelines. There is a certain criteria, like if you do this, if you see this problem, you do this. If you see this problem, you do this. So I always teach them or help them to understand, like, your treatment plan, what you see, no like deviation from standard of care. And if certain type of, we also do behavioral assessment for the child, because for us, it's not just mechanics, it's also, I think behavioral assessment is the most difficult one. And with time, with practice, you just kind of learn the type of temperament kids have, expectations of the parents, because big learning for all of us was probably for all the doctors, when you're out of school, you think you can do it this way, but what are the expectations of the parent? That's a big one, because you think that little bit of like crying or like moving around, that's acceptable. For some parents, it's not. So nowadays we provide general anesthesia. Doctors are, when they come out of residency, most of them already trained in general anesthesia. To work under general anesthesia, so we have an anesthesiologist. But we have certain standards in the practice, and if we see something unusual, we always discuss. We get all together a couple of times, collaborate all the time. So communication, I think, is the key, in setting realistic expectations, and also training, because certain procedures I do, and to get to that. For example, we do those tongue ties, right? I'm the only one who does it, just because it's my interest, and maybe in the future other providers would be willing to train and do certain procedures with.
And they have to be laser certified.
You have to be laser certified, so it's additional. We actually couple of us got laser certified, but I'm the one who ended up doing it because
You like it.
I like it. I think it's just
You're a little bit more brave than others.
Maybe.
Because you work with those tiny little babies there, sometimes 4 days old, 1 week, 2 weeks old. And then it's like, oh my God, this tiny little human being. It's some are afraid to touch them because they're just newborns.
Yeah, so
They don't even have teeth yet.
I know.
Yeah.
When we tell parents we see kids from birth till 18, they're like, oh, really? It's a
And
shocker.
you're talking about a lactation specialist?
Lactation, yeah. We have lactation specialist who is helping out with assessment of those newborns who need treatment, who doesn't need treatment. So we have a good kind of collaboration together. And if any questions come up or new technology comes up, like in my practice, last year we introduced, and you probably never seen it. That's interesting. It's a new injection technique.
It's amazing.
It's amazing. So it's the manufacturer of the product, they call it Painless. I mean, there's little discomfort, sometimes we don't do anything different, but everybody reacts differently. But it's a computerized admission of local anesthetic. So remember when you go to a dentist, if you need to get a shot, for example, right? If you have a filling, now we eliminated it. It comes in a different form and shape. And kids don't even realize that they're getting numb. We call it thermometer. We say, I'm going to measure temperature. So a new innovation comes up, and I love innovation. So we always introduce it to the practice, new doctors getting trained. Now I think we're all using Stone, maybe I think 90% of us just using new technology now. Is that so? It just comes with that.
So, going back to the real estate piece, Bobby, what do you recommend and who do you advise to approach from the financial institutions when it comes to financing a purchase of a piece of real estate?
Well, it's going to have to be SBA. I would say that's the SBA is extremely challenging to get approval. It's a lot of paperwork and patience, but you'd want to find a lender, build a relationship with a bank that offers SBA loans. It's the two different loan program. So the SBA is the program that's going to offer you the 100% financing. And I said 110% because you can also get the 10%, which covers the down payment, because usually an SBA is a 90-10 where you put 10% cash injection, the SBA covers 50% guarantee, and then the bank puts in 40, so 50, 40, 10, and then an extra 10% for your furniture, fixtures, and equipment, TI, with tenant improvement build out, and then the business equity or cash to help get your business flowing. So you can borrow all of that, and being medical, that you take advantage of that, right?
It's called working capital.
Working capital. Thank you. Yeah.
Well, what is the SBA? Let's clarify.
That's a good question, because I remember in dental school nobody mentioned. Maybe they did, and I was not fully aware
SBA,
of it.
It stands for Small Business Administration.
Yes.
So what it really is, and Bobby already mentioned this, but it's the banks that are working with the SBA administration, Small Business Administration, where they guarantee
government?
To the government, guarantee to the banks that if this borrower defaults on its debt, that the government will cover the loan. And that's what really is. There is positive. There is a positive, negative. Not all the time, Bobby. We had 100% SBAs in the past. It's not the only 50, 40, 10. We had 100% SBA in the past. So they all do it 100%. It's just the reason they don't do it, and these are the interesting aspects of it. The reason they don't like to do 100% SBA, because SBA is higher percentage than conventional loans, which you would get from any bank, conventional loan. But then the conventional loans would require 10 to 20% down payment, and that's the reason they don't do it because it's a high risk. So they do it 50-40-10 is because they partially do conventional, partial SBA, because the guarantee doesn't come free. The borrower has to pay the fees for that, and that's why the loan are higher interest, and also there is guarantee fee that you as a borrower have to pay for this. However, that's an easy way to get the loans, but it comes with the price. It comes with the premium. It doesn't come cheap. So it's either you go conventional, but then you have to have cash infusion on your own, or you go SBA. It's going to be a higher price, but they will guarantee. And SBA is the only one that will do based on projection. So you can go in there and you give an Excel spreadsheet that says, this is what I'm projecting I'm going to be able to produce in the first 12, 24, 36 months. And because conventional, they will do on projection, but they're going to be way more stricter, and they will ask you to do a cash infusion into the deal.
So suggestion would be to get the SBA loan, right? For
SBA
newcomers,
would be the
way.
easiest one.
Plus, too, if you look at it as an investor standpoint, you're the less cash injection you have, the higher return on your investment, because you're measuring what your return is on that cash injection. Right? So I'm not a huge believer in over leveraging, but to get yourself going and to get take advantage of it, right? And if it's government backed, why not? It helps you get to where you need to be to get your business going. And another thing we should talk about is you have to occupy 51% of the building to be able to get an SBA. So yeah, we have 11,000 square foot building, but you also have 49% leased out to other tenants. And there's ways to skirt around it, but we won't. This is a public podcast. I don't know if we want to say everything on this.
I think it's important to mention something else. Bobby is right. The SBA, because they don't want you to take the government money and start speculating and putting tenants in there and having using the government money, to finance your project. What they want to do, the SBA has categories of businesses that they support, and healthcare is one of them. So they want to make sure they're truly supporting, because supporting you in a healthcare, because otherwise, if everyone will go there and will occupy 1,000 square feet, but they will buy a 10,000 square foot building, that means there is a certain limit of money that the SBA can lend and guarantee to these banks. That means other health professionals that would be interested, they will not have enough money by the end of the year, because the SBA will run out of money. SBA is not unlimited. They have a certain cap. And once that cap is used, this is it. Until the next year, with the new allocation of government guarantees come in, they're not going to be able to provide financing.
Wow.
So that's the reason they, in order to decrease the speculation with government money, they have a 50% requirement for you to occupy. However, in the ground up, the one we did in Virado, because we did 11,000 square foot building, the limitation ground up, you have to occupy 60%, 61%. So ground ups and existing buildings have a different ratio to occupy.
I didn't know that.
For existing building is 51%. For a ground up, it's 61.
61.
So you have to know that, okay, I want to build a bigger building because eventually I want to expand, because it's a great area, it's a growing area, a lot of families are moving into the area, everything is fine, but you need to understand that ground up, it's always 61% occupation.
And then one of the requirements would be to lease. So you guys typically purchase your buildings in one entity, LLC, and then you lease from yourself in a different entity. And that lease has to be enough to cover 1.25% of the loan ratio. So debt coverage ratio.
Debt coverage ratio, yeah. All right, guys. So I think we covered a lot of things, but one important thing we did not cover: taxation, taxes. After you're making all this great income, you have to give your money to Uncle Sam, right?
Right.
No matter how you look at it.
Right.
So
You're being successful if you have to pay.
that's right.
taxes, right?
That's right. Yes. That.
But there is techniques of how to lower that, right?
Oh,
And
yes.
your husband is extremely creative and has some things that you would like to share, right, Adrian?
Well, the tax code provides a great ways how to save on taxes. So when you own the property and you there is a fiscal policy, it's called cost segregation, and it's a tax benefit. Or what really cost segregation is accelerated depreciation. Depreciation by itself, it's 27 and a half years. So you have certain assets, you depreciate, and it's an expense, but it's a paper expense because it's a non-cash expense. It gets depreciated, and the reason the government does this depreciation, so some of this money is left into the business, and businesses can reinvest, because when the money gets reinvested, it's good for everyone, for the economy. You create jobs, you create expenses, because you're taking this money and you buy other things and reinvest the money. Well, one way the government find out that another way is to give this money back to businesses to accelerate the investments is through accelerated depreciation. And what it really does is, instead of 27 and a half years for those assets, it's broken down in different categories of assets. And some are depreciated at 10 years, some are at 15 years. The equipment could be around 7-year depreciation. So it's a non-cash expense. And this one way is to look on how taxes are getting managed is through cost segregation study. And the way this works, it's really relatively simple. So there is companies that are certified to do the cost segregation. So you cannot do it on your own. You take and do your cost segregation. It just doesn't work the way. So there is companies that are certified how to do it. And so you contact those companies and they will provide those, because it has to be a third-party study. You cannot do it on your own. And they will provide, there is a fee for that, obviously, but they will provide you the breakdown on your expenses, on your assets, and then your CPA takes that study and applies to your taxes. And that's how the cost segregation works.
Yes, and with the big beautiful bill that's now the big beautiful law, takes effect 2026. So it's 100% accelerated depreciation, and you're already lined up for all of your properties, or?
We do it every time we buy a property, and you cannot. You only do it at the year when the property was purchased. You cannot buy the property for this year and apply for taxes the year before. It has to be applied. The property was purchased in 2025. You can do the study in 2026, so there is no issues with that. But it will apply starting with 2025, the year when the taxes and the income was presented.
So when you do a new build, is it when the building's complete?
Yes.
Okay.
Yep.
So not when we buy the land, but when the building's built, the business goes in and starts operating, that's when you could do your cost segregation.
Yes.
Okay.
Mm-hmm.
So with big beautiful bill, is it more depreciation? You can do 100%, you said?
Well, it accelerated.
Accelerated.
Yeah, 100% accelerated depreciation, where before it was a little different. It wasn't as much as, right?
Yeah. Now with starting next year, it's actually 100% depreciation. So it's a great benefit for a lot of businesses, because what it really in effect it does, it's providing the companies with the opportunity to invest more into the future expansions and the future growth.
Yeah, so I think it's very critical, because for businesses, even though you can be a very successful business, you're still always kind of trying to get some reinvestment, and so on. So I think it's a great help for small business owner.
It's a great benefit.
Great
it's all on
benefit.
paper, right? It's not like you're going to get this cash cash in your
that's right.
but
That's
it's
right.
how your paper looks, right? Also, we're doing a closing on one of our properties, and we're considering doing a 1031 exchange. And I'm like, there's nothing out there like that I want to purchase right now. And our tax accountant, our CPA said, Bobby, just don't be forced into buying something and doing a 1031 exchange. Take advantage of the cost segregation. Wait until you find what you want and buy that building and do a cost segregation, and we'll make up for it later.
Huh. That's very interesting.
Do you want to
It's a
cover
good
the
strategy.
1031 exchange? It's another great tax benefit for businesses.
Yeah.
So if you're selling a building, most of the stuff I do is either owner user or investment sales. And it's a way where if you take a property and sell it, and let's say you make, just say you make $1 million, a profit on it after everything. There's stipulations on the 1031 exchange where it's a tax deferral mechanism that's been around forever. It started for the farming community when they would buy and trade land and have to pay taxes on it. And so that's where it all started. But it's still here, and it's all related to real estate. And when you sell your property, instead of paying taxes on $1 million, you would take the net proceeds. It can never go into your hands. It has to go into a 1031 exchange facilitator. And then they take that. And then when you buy, you only have so much time. You have 45 days to identify, 180 days to close. So, and you can identify up to 3 properties. And then you also, if there was a mortgage on it, you have to get a mortgage in the same amount that you paid off. So there's a lot to it, but it is a form of tax deferral.
Tax deferral.
Yeah.
And it's a form of compounding your income, because while you are deferring the taxes, that means you have all these funds available to reinvest and compound them over and over again. So eventually, yes, you're gonna have to pay a lot of taxes, but it's almost like using those tax money that otherwise you would have paid into taxes and reinvest, and that's how compounding works. It's a beautiful way to defer taxes and also compound the incomes over
the years.
Yeah, and if you look at step-up basis, right? So let's say our kids, right? It's all generational wealth, and your investments and your grandparents, your parents, and now they've done the 1031 exchange, kept deferring. I pass away, my kids receive the properties from our estate, and they have it. Well, they immediately need to do an appraisal on the property to find out exactly how much the properties are worth at the time of my death. And then that is a step-up basis. So it locks it in so that when they go and sell the property that they inherited, they only have to pay taxes on what it from that time that I died. So
wow.
So that's what step-up basis is. This is actually, it's an important aspect that people might actually not know that. That's exactly what the step-up basis is. Because that means the gains that otherwise were baked in, they are not there because the step-up basis, it happens from the market price at the time when you receive that property.
Wow. That's a lot to know. It's a lot of information, guys.
This is good.
Right?
You have to build your team. So many people, so many little details. Yeah. I hope this was helpful for everybody. What do you guys, did we cover everything, or is there anything you want to cover? There's a lot more.
It's such a big field, but we covered the good basis. And if we have some questions and there is interest in this topic, I hope Bobby has more time and we can do another podcast, because it's such a great area. It's such a area that it's focused on a small group of people involved in that area. Step-up basis, cost segregation, deferral, increased accelerated depreciation. All those are important aspects you need to know to help you make very good, intelligent decisions, because based on all these details, you would be able to make that way or that decision, because it has a long-term effect. That's why how we started in the beginning. You ask yourself, what's going to happen in 5 years? What's going to be my problem in 5 years? Well, when it comes to estate planning, well, what's going to happen in 20 years, 30 years from now? So you have to ask yourself this question. We never want to face a tough situation where what's going to happen after my death. But, it's reality is reality. Nobody has been able to avoid that.
Yeah.
Being born is an option. Being dead, it's a must. so you have to look into this, whether you like the option or not.
So if you guys enjoyed my podcast, comment below, share with us what questions you have. And I think this podcast is delegated for newcomers, new graduates. I hope you enjoyed it. Share with us. Give us some feedback. We can't wait for your comments. And I'll see you next time with a new guest. Thank you guys so much for coming. We enjoyed it.
Sure. Yeah.
Thank you.
And I think, too, it's never too late. So even if you're just out of school, what if you've been in the field 10, 20 years?
It's never too late.
Right. You still have the ability to start.
Absolutely. Absolutely. On a positive note, we're going to...
Never too late.
Never too late. Thank you, guys. Happy holidays.
Thanks for tuning in to the Ask the Dentist podcast with Dr. Olga Dogear. Remember, a brighter smile leads to a healthier you. Join us next time for more tips, stories, and inspiration for your journey to total wellness.